Hello, everyone. This is Dr. Clark from the Center for Weight Loss Success. And on this episode of Weight Loss Surgery Success, we're going to talk about something a little different today. We're going to talk about some hormone health, hormone balance. We have a special guest with us. Stay tuned. We'll be right back. Welcome back, everyone. This is Dr. Clark again from the Center for Weight Loss Success. And today we're going to talk a little bit about something different, something that actually is very pertinent for most individuals and is probably especially pertinent as we age, and that's some hormone health, hormone balance. Now, if you've listened to my Losing Weight USA webinars, if you've been involved in them at all, you know that this topic comes up multiple times, and we often, whatever topic we're talking about, we'll often bring back are some of the hormonal influences of weight as well as just overall health. And a timely thing, or something I talk about routinely, is hormone balance. And it's that concept of hormone balance that gives us optimal health, and that's what we'd like to have as we age. We like to have it when we're young, but we want to have it as we age as well. So today we're going to talk a little bit about hormone balance. It is pertinent to weight loss. I'm going to say a little bit indirectly initially here, but it can be very pertinent in the long run. When we talk about weight, the weight connection with hormone health, obviously one of the most important hormones I talk about all the time is insulin. Insulin's a hormone that affects blood sugars, but it also directly affects weight. But there are a number of other hormones that you're probably also familiar with, but maybe not so as how it connects with weight. And those are some of the typical sex hormones, which for women, the main ones are progesterone and estrogen. With men, it's testosterone. But what women don't often realize is that testosterone is an extremely important hormone for them in how they feel, their libido, just kind of how they're thinking, how healthy they are, or how healthy they're not. And so we're going to talk a little bit more detail about these type of hormones, but they can affect weight. And some of it, as we mentioned over and over, is that we want to protect lean body mass, build lean body mass, because this is what drives your overall metabolism. Well, some of our sex hormones, and especially testosterone, but actually somewhat estradiol as well, which is one of the human estrogens, are helpful in protecting kind of our lean body mass, keeping our metabolism higher. So I want to introduce a special guest that we have today, and this is Mark Orr, who is from a company called BioT. Mark, go ahead and say hello, and kind of I'll let you introduce BioT as well.
Greetings, I'm Mark Orr. I'm an executive liaison from BioT. BioT is the largest company with a bioidentical hormone replacement therapy program in the United States. Currently, we treat over 9,000 patients per month nationwide, and we have a network of over 400 physicians such as yourself around the country.
Right, and this is something that's been actually around for a long period of time. You know, kind of we talk about hormone health and kind of manipulating hormones. We're going to dive into kind of types of treatment in a little bit, but just the kind of I'm going to say the developers of a lot of this technology and some of the early physicians who are still out there practicing, they've been doing this for years, right?
That is correct. Actually, hormone pellet therapy, which is what we're going to be talking about today, was actually first created or developed in 1939 for women who have had radical hysterectomies, and that's basically where they take the uterus and the ovaries, and in order to help those women function better, they developed estradiol and testosterone implant pellets so that they could have those hormones replaced, because they had no way of being able to manufacture them on their own after that point in time. And so it's been used since that time, both in the United States and in other continents and other countries, in particularly Europe and Australia. In the mid 50s and the 60s, pellet therapy was used less in the United States, but it's seeing a resurgence now coming back into the marketplace.
Right. And a lot of times people think, well, are we just talking about, the older individuals? But when we really think about hormone health, and I've talked about this a number of times, again, on my Losing Weight USA webinars, is that hormone health, we want to optimize hormones. We don't necessarily want to make them, we're not trying to make them super high. We're trying to optimize them. And what we see is that as people age, and this will actually start in their late 20s, sometimes even mid 20s, that all of a sudden these, not really all of a sudden, but slowly, some of these hormones are drifting off. And once they drift off, we become somewhat unbalanced. And so it's not just the older people that we're talking about here. It literally can be fairly young. Isn't that correct?
Absolutely. We find that hormone imbalance can be something that people feel at almost any age, but there are a number of factors why people are finding a hormone balance or a hormone decline much earlier than in the past. A lot of that is environmental factors through our food and manufacturing processes. So we find that, men, like you mentioned earlier, the decline in hormone balance starts in the late 20s, early 30s, and it's pretty slow over the course of the years. So it's what I call the frog in the kettle syndrome. Men just don't notice it. Other people around them may notice it, but men don't typically notice that their hormone levels are declining, because as a frog, as you well know, you put a frog on the stove in a kettle and slowly turn up the heat. He doesn't realize that he's slowly scalding to death. Women, on the other hand, as you said earlier, can see some wild swings starting in their late 20s or early 30s, particularly after that second child, and those hormone levels can fluctuate wildly. That's why women oftentimes become more noticeable or more symptomatic than men do.
Right. So these symptoms that you mentioned, they can be very broad symptoms, and sometimes we often, as physicians, we sometimes think, hey, they're kind of vague symptoms, it doesn't really mean a whole lot. Now, before I dive into symptoms, I wanted to come back to a certain point that we talked about, or we just touched on, is kind of optimizing hormones, in that in an ideal world, we'd all like to feel like we're in our mid-20s and our optimal health, okay? And so sometimes when we think, well, it's just part of aging, right? If we're just aging, it's like, it's natural, it should go down. But we can go through life as kind of, I'm doing okay, or we could go through life kind of feeling our absolute best. And that's what we'd really like to do. So kind of optimizing and normal are two different things. Often the normal range of something. So if you were to go to your physician and you got some labs drawn, they may even check your testosterone or your estrogen, progesterone. They may check some of these things, but they may say, okay, you're normal. Okay? But if you're at the low end of normal, you may not be feeling as good as if you were at the higher end of normal. Again, we're not trying to make these super high levels. It's optimal normal levels. I wanted to stress that because it's a very important point.
Yeah, absolutely. What we basically do as a company, we realized that people were the healthiest and they were the happiest. They felt the best when they're in their 20s and 30s usually. And what we're trying to do is return people to that level. We do not diagnose, prescribe, or treat people going to a super physiologic range of testosterone or estradiol. We bring them back to those levels where they felt the best, where they were the healthiest, where they had the ability to fight disease the best. And that's what we're striving to do. We are not, as some people say, jacking people's hormones to a range that we're not intended to be that way.
Right. And then we do want to kind of hit on that topic of true bioidentical and kind of what does that really mean, bioidentical. You hear that term thrown around a lot, and often women are on, quote, hormones, but they're not actually bioidentical. What's the difference here?
Well, basically, there's two types of hormones that exist in the market today. There's synthetic hormones, and then there's bioidentical hormones. Synthetic hormones are just that. They're artificially manufactured hormones that come from a variety of sources. Typically, you'll see most female hormones are what they call a conjugated equine estrogen. Those hormones are made from the urine of pregnant mares, and I can assure you that there are no receptors in the human body for a hormone that's artificial or synthetic. Now, when you contrast that with a bioidentical hormone, basically bioidentical, I like to use also the term human identical. It's exactly the same molecule. If you look at the hormone molecule in a microscope, and you put a human identical or a human-made hormone on one microscope and a bioidentical hormone on another microscope, they would look absolutely identical. They would function absolutely identical, and your body would recognize a bioidentical hormone as the same hormone that it manufactures itself and that it utilizes itself.
Right, because that, again, a really important concept, because I want to back up just a second, and often people often don't really have a good idea what is a hormone. But a hormone really is just a messenger. Hormone is typically a substance, a biochemical substance your body makes, and it's going to be it releases it into your rest of your tissues or in through your bloodstream. It goes to the rest of your tissues, but it's sending a message for those other cells or those other tissues to do something. And the fact that a hormone is kind of like you had described earlier when we were talking about this, is kind of a key in a lock. And it has to fit exactly. If it doesn't fit exactly, we don't get the message correctly. And that's where the problem comes in, because a lot of those synthetic estrogen or synthetic hormones, then when people hear in the newspaper or on the media about all the bad things that can happen with these hormones, and typically the media lumps them all together, bioidentical and synthetic hormones, they lump them together and say, oh, look at the bad things can happen. Kind of, I don't know if you've probably seen articles just recently about how bad some of these hormones are. But the difference was, and I want you to expound a little bit on this, is kind of looking at synthetic versus bioidentical.
Absolutely. When you see these articles that come out that talk about negative effects of hormone therapy, exclusively they're talking about synthetic hormones. And as you said earlier, basically, hormones are a chemical messenger that's set out into the body to do a particular purpose. And our cells have receptors for those bioidentical hormones. And when those hormones, are linked to the cell, they tell those cells exactly what to do. When you have a synthetic hormone, I kind of like to describe it as a key to an old car. Sometimes if you've ever had an old car and the key to the ignition is a little bit worn out, you stick that key in there, and sometimes it feels like it doesn't want to turn. Or if you have a key, for example, one time I went out into a parking lot and I got into a car that I thought was my car, but it only was the exact color and year and model of my car. When I put the key into the ignition, it felt like it wanted to turn, but it actually did not turn. And so what happens with synthetics is that they almost have a key mechanism that almost fits into the cell, but does not quite fit into the cell. And so when it does attach itself to the cell, it can't tell the cell exactly what to do. Although it does kind of mask the symptoms that a patient may be having, it doesn't have any of the health benefits that the bioidentical hormones have, and in fact can have some negative side effects, as you mentioned earlier.
Right. So let's shift a little bit then. So we talked about some of these hormones, and we're typically talking about testosterone is one of the main one, but also potentially estrogen. I don't want to forget about thyroid. That's another one that's important in hormone health. But let's shift gears a little bit and talk about when people have symptoms of potentially drifting hormones down into lower levels. They're sometimes not just completely obvious, like, okay, you got the bad hot flashes. There are a lot of other symptoms that are actually being caused from that. Can throw a few of those out for us?
Oh, that's a great point. Particularly, well, these are symptoms that can be for both men and women, but low libido, low sex drive, You can have a symptom of tiredness, not being able to go to sleep, or going to sleep and then waking up and not being able to get back to sleep. You have that brain fog that happens a lot of times with women. You know, they forget where their keys are, and this can happen in men too. I don't want to just pick on women. Or they go to the refrigerator, they open the door, and they wonder, did I put something in there, or did I just take something out? Just that kind of brain fog. The energy part is really a critical part too. People may have that 2 o'clock, 2:30, 3 o'clock in the afternoon wall where they have to have some help from an energy drink or caffeine or something to get through the day. That's something that's happens quite frequently. Men, of course, men really don't oftentimes lose their actual desire for sexual activity, but they lose their ability. Erectile dysfunction can happen, and those kinds of things. Women typically are going to be more that they lose their libido, they lose their desire, which the testosterone in both men and women, can bring that back substantially. So there's a variety of symptoms that sometimes people will wonder, why do I feel this way, or what is happening to me, and not realizing because their physician may not be an expert like you are on this subject. Your training from BioT has really caused you to look at things that other practitioners aren't trained on. So that's a real critical aspect of this. And then also, as you mentioned, the optimal, versus the normal. A regular practitioner may go and look at a lab, slip from a patient and see that they're in that lower range and say, well, you're normal because you're within range, but not realizing that if they were in the upper range, that they would feel much better and be more healthy.
Right. All right. Yeah, there's a lot of vague symptoms there that you listed out there, but also, sometimes we'll see just depression. I just don't feel right. I'm not sure what's wrong. Joint pain, muscle aches, tiredness. Again, you hit on a lot of those. And so sometimes they're relatively vague symptoms, but they go directly with some of these hormone problems. And it would give us then an idea. It's like, hey, you ought to get your hormones checked. So when I say that, okay, Mark, let's go check some hormones, what are we talking about there? What labs are we really going to check here?
So basically, there's a specific panel that includes a number of tests that we're going to check a patient to see, number one, if they're a candidate for this therapy. That's the deciding factor, both a clinical evaluation, what kind of symptoms do I have, and then the lab work that's going to help determine that. And basically, that lab work is going to include tests for testosterone in men, free testosterone in men, total testosterone in both men and women, estradiol. In women, you're going to get your FSH, or your follicle stimulating hormone, which is very critical for the dosing aspect. We're going to check your thyroid. We're going to check your vitamin D, which actually is a hormone. People don't realize it, but probably a large segment of the entire population of the United States is vitamin D deficient. That can also be something that is very important. So we're going to look at the entire package. And I think it's important to distinguish that a lot of clinics or offices out there that are doing hormone replacement therapy are only focusing on the estrogens and the testosterones, the androgenic hormones, and there's much more to hormone balance than just those. And that's what we work with the BioT method, and it's very, very critical that we develop both the androgen hormones, the testosterone and estradiol, as well as the thyroid, the vitamin D, and the other things that are very critical to playing a role to a successful outcome to a patient.
Yes, I totally agree with that. Now, when we get these labs. So you've seen the doctor and you've got some lab work, and so now we've got some, what we're saying, okay, abnormal labs. We can try to optimize your hormones, get you feeling better. Now, there are a number of different choices out there. So there are a number of choices that may or may not work as well. And we're, with BioT, and we're a big proponent of kind of potentially using these pellets. But there are other choices out there too. So let's talk a little bit about those other choices and potential maybe downfalls, or where they tend to run into some potential problems.
Well, basically, what's real important to recognize is that our bodies were designed and built to release hormones on a level basis. We want to have those hormones available so that they build health in the body. The other modalities, and we're talking other than pellet therapy right now, are patches, there are creams, there are injections, there are oral pills. There's also lozenges called troches that go under the tongue. And all of these other modalities are trying to, or methods are trying to deliver hormone into the body, but they just don't typically work very well because every other modality or every other method will put people on kind of a roller coaster effect. If you take a shot, your levels are going to go up dramatically, and then they'll start to fall dramatically. If you take a patch or a cream, basically the cream is something that you rub into your skin. There's a cream for men, there's creams for women, and they are basically, once they go through the skin, and it's really important to realize that 45% or up to 45% of people do not absorb through the skin, because you think about it, your skin is designed as a first level of defense against infection and dirt and that kind of thing. It's designed to keep things out and push things away. So we're really asking, by rubbing a hormone in the skin, is we're asking that to go kind of through a one-way street, so to speak, and it's not very effective. But for those women and men who do absorb through the skin, you find those levels rush way high, they get absorbed into the body, and they start to they have a very short half-life, so they start to become metabolized, and then they degrade over the course of time very, very rapidly. So you have this roller coaster effect with shots, with creams, with gels, with the troches as well. So people go up past the optimal level into a supraphysiologic level, then they start to decline rapidly, and then they go below that optimal level. So you'll always find that you're never finding, or you never have a balance of where your hormones should be 24 hours a day, 7 days a week. And so you're zooming up past that optimal level, and then you're zooming down past that optimal level, and we call that a roller coaster. And of course, as you well know, and as most women who are listening to this podcast well know, that women and hormones and roller coasters don't do well together.
Absolutely right. So, which kind of brings us then to go, what we hit on at the very beginning was, okay, there's pellet therapy, which has been around again a long period of time, but the physicians at BioT and the developers there, they've got this down. They've been working on this, and they have this down, so we get very good levels as well as very consistent levels.
Absolutely. Our system is based on well over 200,000 successful patient outcomes over the past 30 years plus, and over 30 years of experience of the developers of our program coming up with a dosing site that appropriately doses each person individually. And I think that's very critical for your listeners to understand. This is not just a one-size-fits-all approach like all other modalities are. Rub some cream on, take this patch, do an injection, and expect that those people get to an optimal level. This is done by clinical lab work. We determine if you're a candidate. We determine what your dosing is. And we also have other things that we add to it to optimize what that level of hormone balance should be in the human body. So we have this dialed in. Our dosing site is a proprietary algorithm of how to treat each and every individual. There's over 1 million different combinations that we can give, and it's never the same, or very rarely the same, for each individual.
Correct. That's kind of the pellets. They work very nicely because they're dissolved, they kind of are absorbed very slowly and consistently. They do require a very minor procedure to place the pellet in the subcutaneous tissue, but it's fairly painless. And then typically kind of we'll recheck some labs in a month to 6 weeks afterwards, make sure that you're kind of where you should be. And then typically for women, they may need to be pelleted or have really a good treatment then for probably somewhere in that 3 to 4 month range. In men, typically 4 to 6 month range. It lasts a little bit longer in men, but the way it's kind of absorbed is dependent on blood flow. So that is when you need more, you'll get more. So if you're exercising hard, you'll actually then, you may utilize it a little bit more and a little bit quicker, and you may need treatment again a little bit longer. But still, we're talking maybe, 3 to 4 times a year maybe, so not that often that may actually need to get done. And it can work really, really nicely. Now, to go into that working really, really nicely, I want to go back to you, Mark. And Mark, we talked about this earlier, as well as you've got what I will say a really good story about this. And so tell us a little bit, as if you will, about kind of your story.
Sure, I would love to. Basically, I've been in the medical industry since 1984, but I took a hiatus from that in the early 2000s, and I went into the retail business, built a very successful retail business, multi-million-dollar business, house on the golf course, this whole thing. It was really great. And then, of course, the Great Recession of 2007 or 2008 hit, and I lost pretty much everything, and that's okay. But basically, during that couple of years, not only did I lose my very thriving business, I lost my house on the golf course, but my mother, who was struggling with Alzheimer's disease for about at least 20 years, she passed away shortly after my mom passed away. My dad had surgery. He ended up having a complication from surgery, and he passed away rather suddenly. So I was faced with, just in a couple of 18 to 24 months, I lost my business, I lost my house, I lost my mom, I lost my dad, and on top of everything that happened, my beloved family dog passed away, and so I was depressed, I was discouraged. I woke up every day thinking, my gosh, what is going to happen to me today? What kind of a disaster is going to happen? And so I was introduced to BioT and the BioT therapy just about a year ago. A good friend of mine in Florida said, Mark, there's a company, there's a therapy that I think could benefit you. So I did some rather thorough investigation. I'm not the kind of person that enters into anything willy-nilly. I did very in-depth research on the studies, found out how much of a past that pellets have had, the hundreds and hundreds of research papers and articles and peer-reviewed journals and studies that have been done on pellets. And I found out that this is something that has proven itself to be safe, it's been proven itself to be effective. So I decided to get treated. I went in and I got treated, and I have to say that I was a little bit disappointed after the first week. Nothing happened. About 10 days after that, I started to sleep a little bit better. And just to let you know, I was depressed. I was not sleeping. I would wake up. I would not go back to sleep. And I started experiencing some of the typical symptoms that a man, of age 55 starts to feel. So 2 weeks went on after that. I was sleeping better. I had more energy. My workouts were more vibrant, robust. My wife and I hike in the mountains a lot, and we ended up, we would do these 10 and 12 and 15-mile hikes, and I would come back feeling refreshed. And then after about 3 weeks, I can remember it just as though it were last week. It was a Sunday night. My wife and I were getting ready in our bathroom for bedtime. She was at her sink, I was at my sink, and we were just chit-chatting, and I was in a great mood, like I had become to be in a great mood from being on the therapy. And she reached over across the sink to me, and she grabbed me by the shirt. She pulled me in close, and she says, I don't even know who you are anymore. You're the old Mark that I married 30 years ago, and you're coming back. This therapy is working. I want you to know that it's fantastic. I love it. And on top of that, I would like to be treated as well. And so as a result, my wife went in the next couple of weeks. She got treated. And I can tell you, the last half of last year was our 34th year of marriage, and the last half of last year was the best year of marriage that we've had so far. So it can really transform relationships. It can really bring back that sense of well-being, that passion for life, so to speak, get rid of that depression. We can get people off of their antidepressant medication and other medications as well, a large majority of the time. And I can tell you that as a patient, I am thoroughly satisfied. I cannot imagine a situation not being on these pellets and my wife being on the pellets. And on top of that, if it was a matter of money, I would eat ramen noodles for the rest of my life if it meant that I didn't have to go off of this therapy.
Right, that is such a feel-good story, Mark. I really thank you for sharing that. So anyway, we're going to wind this little discussion down here. This is something I find it's incredibly interesting to me, and as I learn more and more about it, And very shortly, the Center for Weight Loss Success here, we're going to be welcoming in a new corporation. Basically, it's going to help us with the kind of hormone health and wellness, and the name of it is Center for Hormone Health and Wellness here in Newport News. It's not really off the ground yet, but in the next couple of weeks, it's going to actually be launched, so to speak. The phone number will be 757-223-0940, and that's Center for Hormone Health and Wellness here in Newport News. All right, everyone, I appreciate you listening. This has been a very interesting discussion. I really love some of these odder topics. These are something that are on the fringe of weight loss, but actually they're extremely pertinent for weight loss, because I look at so many of my patients, and this is something that I know it would help them. And I think even more than, I won't say more than the weight loss that we're doing, but even on top of that, it's going to help them tremendously. So if you're interested, want more information, remember, I encourage you to go to our weekly webinar. Sign up for our weekly webinars. Go to our website there. It's www.losingweightusa.com. Or just you can go to our corporate website as well, which is cfwls.com. Well, thank you, everyone, for listening. We will touch base on the next podcast. And remember, it's your life. Make it a healthy one. Goodbye, everyone.